Hello, welcome to another episode of Virtual Breathe Easy Education. My name is Sarah McKenzie. I'm one of the respiratory therapists, the respiratory therapist currently working in Breathe Easy in Red Deer. So today we are talking about breathing management. This, in my opinion, is one of the most important topics that we cover in the entire program because it can be transformational in how you manage your symptoms, how much recovery time you need. Knowing what your breath is doing and having some higher awareness is super, super important. So I'm excited to be sharing this with you today. If you're working in a blue or black binder, this corresponds with section 4 of your binder. There are lots of printed out information in here, including pictures of the breathing techniques. We'll talk about coughing and huffing techniques, as well as the anxiety breathlessness scale. So this is there for your reference, just in case some of this stuff becomes cloudy over time. So today we're talking about the anxiety breathlessness cycle. If you are going in order, Chris introduced this when she talked about exercise. And the beautiful thing is she has a slightly different way of explaining this in relation to your exercise capability and what might happen over time. The way that I explain it is more in the moment. And so altogether, it's kind of a good overall picture of what might happen. We'll also talk about breathing with lung disease, what happens and what you can do about it. Managing shortness of breath, coughing techniques, and some mucus removal techniques as well. So here's the anxiety breathlessness cycle, or as I like to call it, the merry-go-round. As you can see, there's no beginning and no end. So what happens is that with any chronic lung disease, our emotions and our breathing are very closely linked. So it doesn't matter what happens first, whether it's anxiety or strong emotion or shortness of breath. Without being aware, one can cause problems with the other. Okay, so let's go through both examples just so you can kind of get a picture of what might happen. So say you had to run up the stairs to grab the phone that's always on a different floor in another room than you are. So you run up the stairs to grab the phone. Now you're noticing you're short of breath. You have to worry about answering the phone. Oh no, what if they have a question? I can't catch my breath. I can't speak a full sentence. You start to feel anxiety bubbling up. This can increase your shortness of breath because now, oh no, I got to answer the phone. I'm really short of breath. Why did I do that? I shouldn't have run up the stairs. This can lead to more shortness of breath, more anxiety, which the cycle perpetuates, right? And over time, if you are on this merry-go-round a lot, it'll cause you to be more tired, right? Overcoming extreme shortness of breath multiple times throughout the day will exhaust all of your energy through that day, and you might even tap into tomorrow. Okay, so that will actually reduce the amount of activity that you're able to do, and you'll feel more tired, which over time can perpetuate your shortness of breath, and that can also cause you to become more anxious. So it's really important to know that this cycle exists. And I'm sure as you're listening and thinking about your own life, there have been times when you have been on this merry-go-round. It's very scary, right? This feeling of impending doom, this feeling of, I'm never going to overcome this feeling, right? You can. And the point of showing you this cycle and talking about it is so that you can begin to become more aware of how you're breathing and how your emotions are changing and how they can affect each other. Okay, so that was the example for shortness of breath. Let's talk about an anxiety example. So say for example, you get a phone call from your sister-in-law who you don't get along with. And she's talking about something that you don't want to talk about, and she won't let you get a word in edgewise, and you can just feel this negative anxiety feeling bubbling up, like, oh, I want to get out of the situation. She won't let me talk. It would be rude to hang up. All of a sudden, next thing you know, you're panting. That can cause you to become short of breath, right? And we learned when we talk about respiratory disease that air trapping is a big cause of shortness of breath. If you're not getting all the air out, you will become short of breath. So as you're panting and feeling these feelings of anxiety, you're not in control of the conversation, whatever the case may be, this is going to cause you to become more anxious. And now you're short of breath and you're anxious, and away you go on the merry-go-round. Okay, so those are just two examples. Obviously, in your own life, you will have very specific examples, but it's important to recognize, and we'll talk about this a little bit more, what caused you to step one foot on the merry-go-round, right? If you feel that anxiety bubbling up, or if you feel that shortness of breath coming on, one foot is on the merry-go-round. Your awareness of what caused that will help to determine how you overcome it so that you step a foot off the merry-go-round again, right? You don't always have to go around it. And that's really the point. And this is very high level awareness. This is going to take lots of practice, lots of patience. You're going to find yourself on this merry-go-round many times. And then over time, hopefully you're becoming more aware of how those little things are changing, or knowing what tends to trigger you, so you can take the steps to avoid or reduce how much you're affected. Okay, so that's the anxiety breathlessness cycle. We will talk about this in more detail when we build our breathing action plans a little bit later in the program. So breathing with lung disease. So we learned about the two main types of lung disease, and that's obstructive and restrictive. So just to go over this again, in COPD, obstruction on exhalation because of those airway alveolar sacs have been damaged, leading to bigger, floppier airways, causing air trapping, especially on exertion. So trouble getting the air out, right? With asthma, it's also considered an obstructive lung disease, but it looks completely different than COPD. So you have a normal lung picture until you are exposed to a trigger or something that makes your breathing worse, which causes bronchospasm and inflammation. And that's presented this feeling of chest tightness, somebody sitting on your chest, maybe some wheezing or musical sounding to your breath. And this is also obstruction. The bronchospasm and the inflammation make it hard for the air to get out. And then we talked about restrictive lung diseases. So with this, you have an impaired ability for your lungs to expand. And this is most commonly noticeable on exertion. When you're at rest, your breathing rate is slower, more controlled. You're able to get all the air in. As soon as you start to exert yourself, now you have to draw more air in more quickly, and your lungs can't do that. So this will cause a decreased lung volume on chest X-ray or pulmonary function test, and as well, quick, shallow breaths. So really fast, really shallow to try and get enough air in over time. Okay, so let's talk about the first breathing technique. So our bodies are smart. It is likely that you have already been doing this to overcome shortness of breath. You may not never have noticed, even if you haven't been taught. But knowing that this will help, especially with air trapping, means that you can be more intentional with your breath. Okay, so basically with pursed lip breathing, you inhale slowly through your nose or mouth. Okay, depending on what's going on with your sinuses, your septum, if you have a cold, not everybody can get enough air in their nose. And it's important to remember why the nose is the best way to breathe in, right? Because it heats, humidifies, and filters that incoming air. But get the air in however you need to, okay, depending on what's going on. So inhale slowly. And when you exhale, you purse your lips and slowly get all the air out. So it looks like this. So my lips are drawn together. I'm not forcing the air out too much. It's just a slight pursing of the lips, and it's a flowing breath. Okay, so we're not holding our breath on the inhale. We're not holding our breath or forcing our breath on the exhale. How long do you breathe out? as long as you need. So I always say a little bit in and a whole lot out. What this is doing in your lungs, your pursed lips are creating a bit of back pressure. The back pressure goes down into those alveolar sacs and stents them open. So now they stay open long enough to get all of that trapped air out. So this breathing technique is the best for air trapping in obstructive lung disease. But there is a secondary effect, which is why I teach this to anybody, well, anybody at all. When you focus on the quality of your breath, you get out of your mind and into your body. This will decrease anxiety. It'll bring your heart rate down. That bubbling up feeling of emotions, it'll help to keep that at bay, reduce or eliminate it completely. So primary is air trapping. Secondary is that feeling of relaxation. So if you're somebody who has a lot of anxiety, this breath will help you. How long do we do this for? Well, the minimum is about a minute. So that'll give you between 10 and kind of 14, 16 breaths. But you can do this as long as you need. This isn't harmful. You can breathe like this every breath from the moment you wake up to the moment you go to sleep. Okay. And it's going to be very, very helpful to do this breath on exertion. Okay. So on exertion, overcoming shortness of breath, and any other time in between. All right. The next one we're going to talk about. So pursed lip breathing, I'll just go back here. This focuses on getting all the air out. Okay. The next breath we'll learn is actually the other half of the same breath. So diaphragmatic breathing is where does the air go as you draw the air in? Okay, so there's two ways to teach this. Personally, I find the second way more helpful, but I like to teach both so then you get to decide. So diaphragm breathing, you're literally placing a hand, you want to sit up nice and tall, and that'll allow your lungs to 360 degrees inflate. Place one hand on your belly. When you inhale, push your belly out. And when you exhale, feel your belly go in. Watch that your shoulders aren't moving as you're breathing in, because what that means is that you're using accessory muscles of breathing. Okay, our shoulders and our neck like to help out, but it's our diaphragm, which is this big band of muscle that separates our lungs from our tummy contents. This is the main muscle of breathing. And this is actually the first thing to move to trigger your lungs to inflate, right? It moves down out of the way, your belly expands, your lungs fill. It moves up, your belly moves in, your lungs empty, okay? In chronic lung disease especially, our diaphragm tends to get lazy. So if you've ever had really tight sore neck, shoulder, upper back muscles, it's likely because your accessory muscles of breathing are doing most of the work. They're there to help us if we get in breathing trouble, but they're not meant to do all the work, so they fatigue quite quickly. So I always say, if you're not sure what's moving with breathing, stand in front of the bathroom mirror in your underwear and watch yourself. If as you're taking your breath in, your shoulders are the first thing to move, that means that your accessory muscles are the driver of that breath. You can train your diaphragm to do it again. Okay, and that's really what this breathing technique is. Also, by making sure that your abdomen is moving, you're making sure your lungs fully inflate, which will keep the bases of your lungs open, and that's pneumonia prevention. Okay, that might also make your cough more productive. Now you're able to keep those lung fields open and get all the mucus out, right? So that's a good thing. So this is the one way to learn diaphragmatic breathing. This next way is my favorite, and that's rib breathing. So with the hand on your belly, you can move your belly without breathing, right? So it's easier to cheat. And with this next breath, rib breathing, once you feel your ribs expand, you know that the air is going there, right? So for me, it's a little bit better to feel it from the sides than it is to feel it from the tummy. You get to decide what works for you. So with this one, you put your hands on the sides of your rib cage. When you take a big breath in, you're focusing on pushing your ribs into your hands. And you breathe out like this. Breathe in, expand. Breathe out. So that's two parts of the same breath. So from now on, when we say, how are your breathing techniques going? What we're referring to is pursed lip and diaphragmatic breathing, two parts to the same breath. Okay. So I suggest, especially since this is new for most people, practice this at least 4 times a day for at least 1 minute at rest. So in the morning, it's a great idea to do your breathing techniques before you take your puffers. Get your lungs nice and open, cough out the phlegm. Then you have a great open lung to receive those puffers, right? And then other than that, like right before lunch, sometime in the afternoon, and right before bed, especially if you take nighttime puffers, right before you take those as well. So 4 times a day at rest, and then incorporate these when you're short of breath and watch how quickly you recover. It's truly transformational. So breathing on exertion. Now that we've learned the breathing techniques, most of the time when we're walking, when we're working, we're not really focused on how we're breathing. And if anything, we're actually holding our breath. It's our nature as humans to hold our breath when we do something difficult. But if we think about exercise, and really the goal of the exercise portion of this program is to build strength, our muscles need oxygen in order to do that. So we need to be providing them with continuous oxygen because they are always utilizing it. So that's why it's super important to breathe while you're exercising. And there's a way in order to kind of pair your movement with your breath. So inhale through your nose or mouth, get the air in. Purse your lips, exhale as you bend, lift, or reach. Okay, so you take a breath in and you exhale as you bend, lift, or reach. So physiologically, if we think about where our diaphragm and our tummy is moving, when we breathe in, everything's moving out and expanding. So our core, our abdominal muscles are actually expanding and moving apart. So it's still possible to keep them engaged, but exhaling brings everything in. You stabilize from the core, and then you move from there. So that is the best way to breathe. However, everybody's different, and every program I hear, yeah, but Sarah, I've tried it that way. I actually like it better the other way. I like to breathe out and then inhale when I bend, lift, or reach. And that's okay. The point is that you are breathing and you're focusing on your breath with every rep of the exercise you're doing. Okay, so you get to try both. Usually there's one that feels way better than the other, and that's your way. So know your limits and take rests. So we're really practicing on paying attention to your Borg, your shortness of breath scale, paying attention to your oxygen, taking rest, taking enough rest whenever you feel you need. So when walking, so most of us are not paying attention to our breath until we get short of breath. There's a lot of changes that happen on the way to being short of breath. One thing that you could try is to inhale, take a couple steps, and then exhale, take more steps, keeping in mind that our breath out will be longer because we have more air trapped, right? So breathe in, step, step, breathe out, step, 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 as many steps as your breath out is. You will notice that you will walk slower this way. That's the point. You're not leaving your breath in the dust, you're carrying your breath with you. It takes a lot of practice and giving yourself permission to slow down. But what you will do is you'll actually be able to walk farther and do more. by slowing your pace down and keeping your breath with you. So I challenge you all to try this next time you're walking to the bathroom, walking in from the car, see what happens, see how you feel, and report back. So climbing stairs. There is a video on climbing stairs that I will send all of you. This is transformational. I always love teaching this to people because they scoff. They say, yeah, right, stairs are impossible. There's no way that I can do stairs and feel better. And then they get to the top of the flight and they look back like, wow, that made such a big difference. And again, the point is you're bringing your breath with you. Most of us, we get to the bottom of the stairs and we think, Kate, I just got to get to the top. I'll just get there and then I'll deal with whatever my breathing is at the top, right? But if we're thinking about energy conservation, overcoming extreme shortness of breath takes a lot of energy. So by bringing your breath with you, slowing down your pace, your recovery time will be less and you won't use as much energy. And this is huge. This is huge for your total energy bank. Give yourself a little bit more to do the things that you like to do, right? So pace yourself, always use a handrail if you have one available. Take balance out of the equation. And as well, you have something to hold on to so you can more focus on your breath. There's actually two ways to do this. Most people settle on the first way because it just gives you a little bit more breath. Oh, sorry, there's three ways. So most people settle on the second way. So this is the first way. If you're somebody who's like, I don't do stairs are impossible, they're off my list, I just can't do it. This would be a way for you to start doing stairs and then you can build up to the second way. So what you do is you hand on the handrail, you on the bottom stair, feet on the same level, take a breath in. As you exhale, climb one step. Take a breath in on that same step. Exhale, climb one step. Very, very slow, but if you have previously not been able to do this at all, this will get you up a flight of stairs. And if you need to stop and take a couple breaths on the same stair, that's what you do. Okay, and you only climb one stair at a time. So if you're able to climb some steps, but you're finding that you're very short of breath at the top, this is what you do. So hand on the handrail, feet at the bottom, take a big breath in. As you exhale, climb a few steps. So it says 3 to 4. Everybody's breath and capabilities is different. So some people might take a breath in, climb 2 steps as you breathe out. Some people might take a breath in, climb 3 or 4 steps as you breathe out. You're breathing out until your body tells you to breathe in, at which point you're stopping with both feet on the same stair to take your breath in. And then you're climbing as you breathe out. Okay, this is what most people settle on because it gives you some time to take your breath in and then you're still moving up the stairs. So you are able to get up a little bit quicker, but it's much slower than most of you are doing stairs. Okay, and if you're able to climb stairs, say you can get 2 flights in and then you stop for a little bit of a rest. Here's a way that you can climb more quickly but still breathe. Inhale at rest. Climb 3 to 4 steps while exhaling and 2 steps while inhaling, or however many you're able to do. The idea is that you're climbing as you breathe in and you're climbing as you breathe out, but you're climbing more when you breathe out because your breath out is longer. Okay, so this one will get you up the quickest, but most people settle on the second one because it gives you that time to stop and take your breath. Okay. So my challenge to you is to try stairs. Try these methods. They're in your in section 4 as well. Page 4B, you can find climbing steps. So try those methods and see which one works and let me know how it went. So Switching gears a little bit here, let's talk about body positions. So it's really important, especially when we're doing breathing techniques or overcoming shortness of breath, that we are taking steps to make sure that our lungs are able to expand. So that's where body positions come in. So when we're doing breathing techniques, we always want to lean forward a little bit. And again, our bodies are smart. Chances are, if you're overcoming shortness of breath, you're already doing this. So if you've ever leaned on your shopping cart, leaned over on your counter when you're short of breath, this is why. And physiologically, it makes sense because our lungs are actually bigger on the back of our body. So if we're sitting up straight and leaning forward, we're able to send the air to the biggest part of the lungs, the bases of the lungs, which are on your lower back. Okay, bodies are smart. But knowing this and knowing why, you can be more intentional with your body position. So you want to lean slightly forward, support your arms when possible. We always want to support our arms because it takes balance out of the equation. If you're extremely short of breath, maybe you're a little bit dizzy, maybe your oxygen levels are really low, the last thing you want to do is go down, right? So you want to make sure that you're steady so you can overcome that shortness of breath and move on. Here are some examples of body positions. So depending on where you're at when you're recovering, sometimes a chair might be available. I would caution against a chair with wheels unless you're currently in a chair with wheels. When you lean forward, if that chair goes back, you're going down on your face, and that's going to be very bad. So a chair without wheels is preferable, but again, it depends what you have available, right? So on the left here, he's leaning forward. He has his elbows on his knees. The biggest part of his lungs are expanded, and he can recover from shortness of breath here. Some people prefer to lean forward on a jacket, a pillow, something like that. I find people either really love this or really hate this. Sometimes having something on your chest close to your face makes your claustrophobia worse, which can cause you to be more anxious and perhaps go around that merry-go-round again. So that's not helping the situation. So again, try this. If it works, great. If it doesn't, that's okay too. If you're standing, you can either lean with your hands on a table or actually lean forward on a counter. And say you're going for a walk and you get really short of breath and there's no bench or anything to sit around, to sit down on, you make sure your feet are at least hip distance apart, slight bend in the knees for support, and lean over and get your hands on your legs. So this is a steady position that will help you to overcome shortness of breath. Maybe you can see the bench in the distance and you'll do the breathing techniques for say a minute, 2 minutes until you're able to move to the bench, and then you can relax from there. So it's always important to remember that this is available. Most of the time, if you're really short of breath, you're looking around for somewhere to sit down and it's instant panic. And that's the merry-go-round, right? You're like, oh no, I'm short of breath. I can't sit down. Oh no, this is really bad. This is really bad. And around you go. So knowing that you have that body position available and you can recover from shortness of breath, right? It's a temporary feeling, especially if it comes on acutely. You know, if you have a pneumonia or a chest infection, you might be short of breath for a longer period of time, but there's something else going on, right? Acute shortness of breath that comes on for whatever reason will go away. Okay, so just remember that, and you can tell yourself that this is a temporary feeling. I have the tools to overcome the situation. So breathing management. So these are the steps that you would take if you're acutely short of breath. It's really, really empowering to know that you have these tools in your tool belt. It really helps with anxiety to know that you have the tools that you need. So the first thing you want to do is recognize that you're short of breath. This is the single hardest thing. Most people, they might be aware that their breathing is changing, but most of us don't take it seriously until we're like 8 out of 10 or 10 out of 10. Right? I'm just going to push. I got just a little bit more. I can do it. I've always been able to walk this far, whatever the reason. And all of a sudden you're 10 out of 10 short of breath. So the first thing you want to do is stop. depending on what's in your area, maybe you have a bench or a chair to sit down, maybe you have a shopping cart to lean on, maybe you don't. So get yourself in a comfortable position. Stay as calm as possible. Easier said than done, right? That anxiety is going to be bubbling up right away, that feeling of impending doom. This is what we want to recognize. This is anxiety. Anxiety lives here, all tight, hunched in, hunched over. Is that a good breathing position? No. So sometimes just saying, okay, I'm going to relax my shoulders. What you're doing is you're signaling to your body that now it's time to relax. So you're already starting your recovery by forcing your shoulders to relax. Now you can expand your lungs. You're in a better body position. Okay. Introduce pursed lip breathing. Inhale through your nose, through your mouth first if you must. So if you're actually being able to breathe out as long as possible, might not be possible, right? So you want to start and work towards your breathing techniques. It might take a minute or two, maybe 3. So hang on, the phone's just ringing. Oh, the joys of teaching from home. So where am I? Introduce pursed lip breathing. So what you might have to do initially is take a breath in, and you're working on making your pursed lip breath longer over time, right? So that's pursed lip breath is the goal. You have to start with what you have and work your way to that goal, right? And give yourself as much time as you need to get there. The focus is to slow down your breathing. You know that panting means air trapping. So over the next minute or as long as it takes, you're working on slowing your breath down and getting all that air out. You never want to force your breath out because too much back pressure can cause your airways to collapse. Okay. So continued. Continue to exhale gently through pursed lips and inhale through your nose once possible, if it's possible, right? So knowing that your nose heats, humidifies, and filters that incoming air, if possible, that's what you're working towards. So continue relaxed breathing for 5 minutes. That's it. I always laugh. That's a very specific time. But the point is that you will give yourself as much time as you need to feel like you're recovered. So depending on how short a breath you are, what the situation is, you might feel like you're ready to move again in 1 minute. It might take 10 minutes, right? Give yourself the time. This is where communication with your support people, your walking buddy, whoever's involved, is really important. So in advance, hey, if I get to the point where I need to stop and breathe, are you okay to sit or stand with me until I'm ready to move again? Then there's no pressure, right? There's no pressure. They're not asking, oh, what's happening? What can I do? Oh no. And they're making your anxiety worse when you're trying to recover, right? So if you say, hey, I love walking with you. Can we go at my pace and can we stop for rests when I need to? Right? Communication is key. So that's breathing. Practice those breathing techniques. Communicate with the people in your life about what you may need to be successful in giving yourself time to recover and all of those things. And it's going to make a big difference. We're going to switch gears here a little bit and talk about some coughing techniques. So the goal of coughing techniques is to remove sputum, phlegm from your lungs while using the least possible effort. If you have phlegm as a normal part of your day-to-day, I'm sure everybody has been in that situation where you get into a coughing fit. Maybe the phlegm is thick, maybe it's kind of stuck in an airway, you can feel it in there and you cough, 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 cough. And then by the time it finally comes out, you're done. There's no more energy. You've utilized all your energy for the day. Maybe you have to take a couple puffs of Ventolin, lie down for a while. We don't want to do that all the time. right? So by using these coughing techniques, what you're doing is you're getting the phlegm out so that you can get on with your day. So this also, getting the phlegm out quickly when you feel like you have a cough there, this will decrease pneumonia risk. When phlegm sits in the airways, because remember, phlegm is the last layer of filtration that your body has for any incoming bacteria and virus. So, and the point is that it traps that, and then we cough it out to get it out of our lungs and the delicate lung tissue. If it sits in there, especially if that airway is closed, that whatever it has trapped is now going to multiply. And that's when our risk of infection increases. So we always want to keep phlegm moving. So points to remember, as I said, try to avoid coughing in fits. It's important to save energy. It's not always possible. Sometimes you get that tickle and a split second later, you're off. That's not what we're talking about here. What we're talking about is when you can feel like there's something there and you have a bit of time to prepare. This is what will help you the most. So the first one we're going to do is controlled cough. So you want to sit with your feet flat. Why is this important? Well, we want to take balance out of the equation. If you're coughing with a strong force and you're kind of sitting over like this, A, you might fall down, and B, you might pull a muscle. If anyone's ever pulled a muscle in their lung, in their rib cage, we have lots of tiny little muscles kind of braided around our rib cage. That's really painful. So we want to make sure that we're able to expand our lungs fully and equally. Lean slightly forward. With this cough technique, we start with a big breath in so that our exhale, our cough, can utilize the most force that our lungs are able to produce. Leaning forward, make sure that we expand the biggest part of our lungs on our back, right? Inhale deeply through the nose or mouth. This part isn't as important. Just get a nice big breath in and cough 2 to 3 times. So I'll show you what this looks like. Lean slightly forward. I have my hands on my thighs to stabilize. Take a breath in. So you never want to cough yourself completely empty because that can also cause airway collapse. You want to cough till you're about 70% empty and then take a breath in. I did a few in a row. You might find that you do followed by some breathing techniques to catch your breath. Maybe you're spitting into a tissue at that time too, or you may find you can do several consecutive coughs and breaths. Okay, so how you choose to do that depends on how you're feeling. So you're spitting mucus into a white tissue or a Kleenex, and you're looking at it. Okay, so yeah, I know it's gross, but at least once a day, we want to be looking at our phlegm. It's important to know what's normal. And when we talk about building our breathing action plans and how to tell if you're getting a chest infection, our phlegm changes color 2 to 3 days before we feel sick. So we can be on antibiotics and prednisone long before we're feeling really, really yucky in the effects of that chest infection. So at least once a day, take a look. You want to see the kind of the same color-ish. Sometimes you get, I hear, yeah, it's usually clear to yellow and occasionally gray. Okay, that's normal for you. If all of a sudden you're seeing yellow or green or way more, or it's way thicker, or it has a different smell or taste, that's a change, right? Repeat is needed. So again, this isn't going to be harmful. This is very effective because you're utilizing a full breath, so more pressure for the cough. So hopefully you're able to get that phlegm out with maybe even just one go or a couple goes. All right. So what do you do if you're trying the cough technique and you're not able to get the phlegm out? You can feel like it's in there, it's just not coming out. Well, we have the huff technique. So keeping in mind, this is why we don't force our breath out when we're purse slip breathing, is that sometimes too much force can cause premature airway collapse. So you can feel the phlegm in there, but when you're coughing, the airway closes and traps the phlegm. The huff technique might be really helpful for you here because it utilizes less total force. Okay, so same idea. You set up the same, sit with your feet flat, lean slightly forward, take a big breath in, feel the bases of your lungs. Instead of coughing, this time you're exhaling in short bursts. Imagine you're fogging up your bathroom mirror. So it looks like this. So I'm leaning forward, hands on thighs, take a breath in. Make sense? So you're huffing little short bursts, less total pressure, but the idea is it's not enough pressure to close the airways, so that phlegm sneaking up to the point at which it's supported by smooth muscle in the airways, and now it can be coughed out. Okay? Again, don't huff forcefully and never huff yourself fully empty. I find that this way makes, like I have asthma, and I find that the huffing does actually make me more short of breath. So what you might want to do is do a huff and followed by maybe a minute or so of breathing techniques, maybe 30 seconds, just until you get your breath back, right? We don't want this to become exercise. Huffing and coughing does cause you to be short of breath because you are using extra force. So give yourself enough time in between to recover, okay? So that's the huff technique. Try both of those, especially if you have phlegm. If you have lots of phlegm as a part of your day-to-day, it becomes so important to be able to mobilize that effectively without using too much energy, okay? So mucus removal. One thing, the first thing that I always suggest when people tell me, you know, I have thick phlegm, I got to work at it, it doesn't always come up. I ask, how much water are you drinking? Being well hydrated has a direct effect on the thickness of your phlegm. Most of us are walking around borderline dehydrated. It's easier than having to go to the bathroom 15 times an hour, right? So drinking more water, especially if you're already on a lot of medications, it's an easy way for you to change the thickness of your phlegm without adding more medication. Okay, so drink a little bit more water. I like to try and get the majority of my water content drank by early afternoon so that it gives my body some time to deal with the excess so that I'm not waking up multiple times in the night to pee. So add an extra water bottle or two and notice what happens with your phlegm. It usually has a big difference. Limit caffeine and alcoholic beverages. While I'm not in the practice of telling people how to live their lives, but again, knowing that caffeine and alcohol are both diuretics, meaning it makes your body pee out more fluid than it typically would. They have the ability to make you more dehydrated, and it has the ability to make your phlegm thicker. So if you're noticing that your phlegm is thick and you're drinking a lot of caffeine, whether it's coffee, whether it's tea, whether it's energy drinks, or if you're drinking, you know, a few glasses of wine or a few beers a day, then it might be a good idea to take a look at that and see if you can reduce a little bit, knowing that we want to keep ourselves well hydrated. Okay. Do your breathing and endurance exercises. So keeping your lungs open and expanded will help to keep the phlegm mobilized. You won't have airways that are trapped, or you won't have many airways that are closed, trapping phlegm. Endurance exercises, so moving our body through space, helps to keep phlegm mobilized as well. The worst thing that you can do is sit immobile in the same position on the same chair or couch all day. Right? So get up and do things. Remember, not everyone with lung disease has increased mucus. So if a part of your day-to-day lung disease symptoms does not include phlegm, keep in mind that when you get a chest infection, not if, when, as anybody with chronic lung disease, we are more susceptible to infection. So your likelihood of getting just a little sniffle becomes less and your chance of it going straight into your chest becomes more, right? So it's really important that we know how to mobilize phlegm when we're overcoming a chest infection, right? As that bacteria begins to break up with the antibiotics and the inflammation starts to be dealt with the prednisone, the only way to clear that infection is to cough it out. So doing so effectively will make a big difference. So for large amounts of mucus, mucus removal devices are available. And there's also postural drainage and chest physical therapy. So postural drainage, if you have, one lobe or one lung on either side that tends to fill, depending on your lung disease diagnosis, there are some lung diseases that have this happen. What they do is they place you in a position with your bad lung or bad lobe up, which allows gravity to help drain the mucus and phlegm out of that side of the lung. So that's postural drainage. And chest physical therapy. So basically, whether it's they can percuss you, so it's tapping with rounded palms on different parts of your lungs to help and rattle the phlegm out. They also have percussion devices. So they're like big hand massagers that they will put on your lobes of your lung to help and again rattle that mucus out. So that's chest physical therapy, and those are provided by physiotherapists. There's also mucus removal devices. So if you have a lot of phlegm as a part of your day-to-day, it's tough to mobilize despite being adequately hydrated. This is when we start to look at some devices. So there's 4 examples here. The most common one we see is Aerobica. You can pick up an Aerobica at any pharmacy, Costco. It'll run you between $80 to $120, which is an investment, but it can be transformational to how easily you deal with your phlegm. So basically how these devices work is they're called flutter devices. So you breathe out into them. They cause vibration to go down into the lungs, which can help to rattle the phlegm loose from the inside. And then you cough it out. Okay. So can be very effective. If you do have a lot of phlegm, you can chat with your doctor about whether it'll be a good idea, or you can simply go and purchase one and try it out for yourself. So that's it for breathing management. Lots and lots of gold nuggets in here. Definitely let me know if you have any questions. And if we're looking at the requirements for graduation, that little sheet of paper, breathing techniques is on there. So the goal is by the end of the program, you have a good overall knowledge and confidence of how to do the breathing techniques, when to do them, you've practiced them, and you feel confident to check that off. Okay, so any support that you need from now until then, if you want me to watch you breathing, if you have some questions about the breathing techniques, definitely reach out, okay? The goal is that you are able to feel confident enough to check that off. So this confidence and motivation scale is something that we'll see from now to the end of the program. Basically, you assign a number to how confident you feel with breathing management. If this is the first time you've heard all of this, chances are your confidence may be less than 5. All that means is that you need more practice. Maybe it's a conversation with me. Maybe it's getting me to watch you breathe. Maybe it's getting out into the world and trying the breathing techniques, overcoming shortness of breath. To build your confidence, right? And if you have already been taught these, maybe this isn't your first time in the program, maybe you're already utilizing them, maybe your confidence is higher, right? So what kind of support do you need based on how confident you are right now? And that's really identifying that in yourself and then taking initiative to build your confidence. Okay, that's the point. So to summarize, be aware of your breathing during activities that make you short of breath. High level awareness. You are now having to be aware of something you've never had to be aware of in your entire life. This is going to take practice, okay? Give yourself grace to make mistakes, to not be as aware, to catch it a little too late, and over time that will improve. Practice the breathing techniques at home on exertion, and you'll have lots of opportunity to practice in exercise class. We will remind you, we'll be watching how you're breathing. We'll see if you're holding your breath when you're doing those exercises, and you'll get to build some confidence and awareness. Pursed lip breathing, diaphragmatic breathing, and body positions. So knowing what body position works best for overcoming your shortness of breath and making sure that you are setting yourself up for success when you're overcoming it. And keep your lungs clear of mucus. So everybody drink your water. Let me know if you're still having some problems, and maybe an aerobica might be the thing for you. So what activities cause you to be short of breath? There is an awareness exercise, I believe. Oh, maybe not. Observe your breathing during daily activities and discuss different strategies, or try the different strategies we talked about today to improve the control of your breathing, right? So being aware of how it's changing moment to moment, knowing when to stop, and actually stopping and incorporating those breathing techniques. It's going to take practice, guys, but you can do it. So, and that is it for today. Definitely let me know if you have any questions, and good luck with those breathing techniques. Till next time, bye-bye.